Full patient assessment. Checking the scene for scene safety for myself and my crews. Scene is safe. We have our BSI donned. No other patients present, just the one. No bystanders to take a sample history from. Mechanism of injury seems to be a ladder. Patient fell off, probably hit their head. General impression, I have a male, late 20s, early 30s, who is not moving. I'm going to ask one of my partners to manually stabilize the patient's head, manually stabilize the patient's C-spine while I begin the assessment. I'm going to verbally talk to the patient. Hey sir, can you hear me? Patient does not respond. I'm going to pinch the trapezius to get a painful stimulation. Patient doesn't respond. I'm going to do a modified jaw thrust and listen to his airway. I see no obstructions. I hear that his breaths are 36 breaths per minute, and I hear snoring. So I will ask one of my partners to size and insert an OPA into NPAs into the patient. The patient accepts. No suctioning is required at this time. Moving on to breathing. I'm going to check the trachea for any JVD or deviation. None is present. I'm going to ask another partner to apply a BVM, 15 liters, 100% O2 high flow at 1 breath every 5 seconds. Patient accepts. I'm going to expose the chest to see if there's any trauma in the chest. There's discoloration on the left side of the patient's chest. I'm going to then check for circulation at the central and radial parts of the patient. I have a pulse, 140 beats per minute, weak and rapid. I'm going to check for hemorrhaging of the patient. No bleeding is found of the patient. Checking the skin color, appearance, and temperature of the patient. He's cool, pale, and clammy. At this point, I will determine that the patient is a high priority patient, needs to be transported immediately. We need a paramedic intercept and a trauma team alerted at the hospital. I will have a partner of mine go and get the C-collar as well as the backboard for aiding in extrication as I begin my DCAP BTLS primary exam. Starting at the top, checking for any deformities. No step off on the cervical, no deformities on the cervical area, no battle signs behind the head. My partner is back with the cervical collar. They will size and secure the stabilization of the C-spine. Moving down, checking again the chest, checking the sternum is intact, checking the peritoneal area, checking one hip, two hip together, in, not down, no deformities, no crepitus. Moving down to the left lower extremity, I expose it. A discoloration and deformity is present. I will note it and work around it, making sure not to press in on it. Checking the pedial pulse of the patient. No pulse is found. Right lower extremity exposed. Checking for deformities. Again, pedial pulse, 140, weak and rapid. Checking the arms. No deformities. Pulse, 140, rapid. No deformities, 140 pulse and rapid. I'm going to then check for partner is back and we are ready for extrication. Patient's head is stabilized in a C-collar. 1, 2, 3. Checking the back for posteriorly for any deformities or fluids. Backboard's down. Patient's rolled. Patient is secured to backboard and ready for transport into the ambulance. Patient is in the ambulance. I will now do my secondary survey of the patient, starting at the head again, doing a more detailed look at the orbital sockets, the maxilla, the mandible. None are found, no deformities found. Checking the posterior cervical spine, no deformities are found. Checking for battle signs and CSF, none are found. Checking the trachea for JVD and dissension, none is found, still the same. No medical tags on neck found. Rechecking the chest again. Checking for bilateral chest rise. Lack of chest movement on the left side. Checking again for breath sounds. No change, still decreased breath sounds on the left side of the patient. Checking again the peritoneal area, checking the hips in, not down, nothing there. Now that we're in the ambulance, we will take care of the left lower extremity. I will have one of my partners apply traction now that there is no issue found with the hips. Fracture is cleared. There is still no pulse found in the pedial area of it. I'm going to have the patient, can you push down on my hands? And push up on my hand. Capillary refill. No CSMs present on that one. Checking the right lower extremity. No changes. Pulse is the same. Can you push down on my hand? Can you pull up on my hand? Cap refill. CSMs present. Checking the right upper extremity. Can you squeeze my hand? Checking cap refill. Now that there's no injury in the right arm, I'm going to check for blood pressure. Blood pressure of 80/40. Moving on to the other arm, the left arm. No new deformities present. Can you squeeze my hand? Can you push my hand? Can you squeeze my hand? Can you push my hand? Capillary refill is present. I'm going to check the pupillary response. Pupils are unresponsive and unequal. Patient needs to be reassessed every 5 minutes. With vitals, we will put a blanket over him to keep him warm. We will also test his blood sugar level by using a glucometer, and we will apply a 12 lead to give to the paramedics.